Recorded Medication Teaching, an initiative of the Manitoba ACS Network and St. Boniface Hospital. Beta blockers. Beta blockers are a type of medication that make the heart slow down and relax, protecting it from stress. Beta blockers can help the heart muscle recover after a heart attack and can help prevent heart pain, also known as angina. They can also help to preserve or even improve the function of a weakened heart muscle. Beta blockers can help to prevent or treat abnormal heartbeats or arrhythmias, and may also sometimes be used to lower blood pressure. Examples of beta blockers include metoprolol, bisoprolol, carvedilol, atenolol, nadolol, and propranolol. Beta blockers should be taken at the same time every day with or without food. If you take your beta blocker more than once a day, try to space the doses evenly throughout the day. If you miss a dose of your beta blocker, take it as soon as you remember, unless it's almost time for your next dose. Do not take an extra dose to make up for the missed dose. It's very important to keep taking your beta blocker even if you feel well, since the protective effects of beta blockers are not something you would normally feel. It may be harmful to stop taking a beta blocker too quickly, so if you think you are having problems with your beta blocker, talk to your healthcare provider. Don't stop taking it on your own. Since beta blockers slow the heart or pulse and lower blood pressure, they may make you feel dizzy or lightheaded. This may increase your risk of fainting and having a fall. If you get dizzy or feel faint, sit or lie down right away to lower your risk of falling. If you find you sometimes feel dizzy or lightheaded, make sure you walk slowly up and down stairs and change body position slowly, especially when standing up or getting out of bed. You may want to first dangle your legs over the side of the bed before standing up. If you have a blood pressure machine, check your blood pressure when you feel dizzy and make a note of it. Let your nurse or doctor know if you take a beta blocker or other blood pressure lowering medication and feel faint or dizzy. Often, the problem can be solved by adjusting your dose. Beta blockers can make some people feel tired or sluggish, especially when they're first started, but often this gets better with time. Some people who take beta blockers may have colder hands and feet than normal and may feel more sensitive to the cold. Some men may have less sexual ability if they take a beta blocker. Talk to your healthcare provider if you take a beta blocker and may be having any of these side effects. If you have diabetes and take a beta blocker, you may need to watch your blood sugars more closely. Beta blockers can make it harder to notice the signs of low blood sugar, especially a faster heart rate or pulse, and feeling shaky or tremulous. Feelings of dizziness, hunger, and sweating due to low blood sugar will not be affected by beta blockers. People with asthma usually should not take beta blockers. Talk to your healthcare provider right away if you take a beta blocker and have trouble breathing or unusual swelling of the feet or ankles. You should also talk to your healthcare provider if you develop depression or nightmares while taking a beta blocker, or if you notice that your heart rate or pulse has fallen to under 50 beats per minute. Beta blockers can play an important role in protecting the heart muscle and preventing heart pain, as well as lowering blood pressure, preventing abnormal heartbeats or arrhythmias, and preserving or improving heart function in those with a weakened heart muscle. Thanks to these beneficial effects, beta blockers, along with other heart protective medications, can help you lead a longer, healthier life.